What if hot flashes are your brain misreading your body? Welcome to Science My Health, your channel for health and research information. Hot flashes affect up to 70% of women during menopause. They are not just uncomfortable, they can interrupt sleep, disrupt daily routines, and lower overall quality of life. Hormone therapy has been the most effective treatment for years, but it is not the right choice for everyone. Because of that, researchers have been developing non-hormonal options that target the problem in a different way. So, what actually causes a hot flash? Think of your brain like a thermostat that keeps your body temperature stable. During menopause, estrogen levels drop. That affects the hypothalamus, which controls temperature. When this system is disrupted, the brain can misread normal body temperature as too hot. In response, it triggers a cooling reaction. Blood vessels expand, sweating increases, and you feel a sudden wave of heat. When this happens at night, it can repeatedly wake someone up, which is why sleep problems are so common during menopause. What if you could treat hot flashes without hormones? Instead of replacing hormones, newer medications try to fix the signaling problem in the brain. Two of these medications are Veozah, also known as fezolinetant, and Linquet, also known as elinzanetant. They block specific signals involved in temperature control. Fezolinetant targets one pathway, while elinzanetant targets more than one. Researchers studied these drugs by combining data from 7 randomized controlled trials, including 4,087 women. This kind of analysis gives a clearer and more reliable picture of how well they work. Do these medications actually work? Yes. Both medications reduced how often hot flashes happened and how severe they were. But there were key differences. Elinzanetant had a stronger overall effect. It reduced symptoms more and had a much larger impact on sleep quality. Fezolinetant also improved symptoms, but its effect on sleep was smaller. What about side effects? Fezolinetant did not show a clear increase in side effects compared to placebo and was generally well tolerated, with similar rates of headaches and no significant increase in serious side effects or discontinuation. Elinzanetant was linked to more drug-related side effects overall, especially headaches, and a higher occurrence of treatment-related adverse events. Serious side effects were rare for both medications, which is important when considering long-term use. So how do you choose between them? It depends on the symptoms. Fezolinetant may be a better fit for people with milder symptoms or for those who want to minimize side effects. Elinzanetant may be more useful for people with more severe symptoms, especially if sleep disruption is a major issue. This reflects a shift toward more personalized treatment instead of a single standard option. What are the limits of this research? The studies use different medication doses, which makes it harder to directly compare results. The total number of studies was also relatively small, even though the findings were consistent. Researchers also still need direct comparisons between these medications and other non-hormonal treatments to better understand how they compare. What is the takeaway? Non-hormonal treatments for menopause are improving. Both medications reduce hot flashes and improve quality of life. These findings give people more flexibility in how they manage menopause symptoms. Give us a like if you learned something new and subscribe for more health research news.